In last week's video, we started talking about knee pain in athletes, particularly in their middle school, high school, and even college years, growth years. Sometimes these things can be helped with exercise, sometimes they can be helped with speed technique, and sometimes they require bigger solutions. So what we focus on here are things that are potentially fixable. So if somebody has a partial ligament sprain or a meniscus tear, or they're in their growth years and has some sort of diagnosis like Osgood-Schlatter or something along those lines, or if they're just plain overused in their sports, playing so much that they're just overworked, we can't fix any of that with exercise. But there are some things that we can fix with exercise, and today we're going to talk about feet that are rotated when they strike the ground. So I want you to picture an athlete, I'll back up so you can see a little better, sprinting, and as they come at you, that foot should strike the ground straight forward or relatively close to straight forward. But if you watch video of some athletes, what you'll see is that they'll come through and they'll land sideways like that. And you see it in slow motion, it looks painful, right? And it obviously causes pain, and imagine how many steps and how many day after day after day, games, practices, whatever, where that foot is landing in a position rotated like that, where it's hitting on the inside when it should be striking straight in the front, and it causes pain where things aren't designed to handle that load. So what we want to do in our exercises today is try to realign those things, and I'm going to give you two exercises just like last week to fix this particular problem. Athletes that might have this particular condition would see not just knee pain, but they would probably also experience foot pain from time to time. They could have shin pain from time to time, and it even could work up into their hip because they're landing in an awkward position. So our two drills for today, first is a stretch. So what you'll need is something to sit up on so your feet are off the ground. And I'm using a foam roller, but you could put almost anything in there. A couple of books, just something where you're pressing your knees together and your hips can't rotate. The rotation has to come from below the knee. So what I'm going to do is put the foam roller between my knees. Whatever you have at home is fine. You can pull your toes up as far as they'll go towards your shins, and then you just rotate them in. This is a stretch that I need as well, so I'm not going to be able to touch my toes. If you're good at this, you probably can get them all the way in and you wouldn't need it. But if you feel restriction on the outside of your leg because everything's so used to being rotated out, this is going to give you a good stretch through your lower leg, usually the shin part. So there's one exercise. You can work that in daily. It's not that intensive. Maybe, 30 seconds worth for a couple of sets would be plenty. The second reason why I might rotate out is because I might be off balance. So I might be sprinting and I won't fall, so I'll catch myself side to side and create a wider base with a wider foot position. So in this exercise, we're going to work an inline lunge position and try to help you create that control. So it's key that your back foot, your knee, and your front foot are all aligned. So my back foot will be down here, put my knee on the pad, and then I've got to get my other leg directly in front, and that's not easy to hold, for me at least. And then I've got to get up perfectly tall. So my sprint position, I should have tall posture. And then from here, if I'm wobbling already, I don't need any more than this. But if I need a bigger challenge, I can do a light side raise and hold for a second. And that's going to challenge my ability to create control on the smallest or thinnest possible plane. So partially, my heel strike or my rotational strike could be flexibility. It could be core stability. It could be some other things, but to keep things simple, let's focus on these two, and maybe they'll help you to take away some of your knee pain.